Hello, it's Dr. Rhonda Johnson. Today is Monday, June 26, 2023. Today I'm talking about malaria. Well, you may have heard that the Florida Department of Health released information that there have been 2 cases of malaria, the first in 20-some years. These 2 cases, one occurred in Sarasota and one occurred in Manatee counties. And they confirmed that the cases were local, meaning the people did not have any history of international travel. They were caused by the Plasmodium vivax malaria parasite, that species that doesn't cause a severe illness as other malaria species. The Florida officials advised that anybody in that area with symptoms of fever, chills, sweats, nausea, vomiting, and headache should seek immediate medical attention. Now, the state of Texas has reported a local case, again, person had no history of international travel, of malaria in Cameron County. This man reportedly worked outdoors, and Texas officials are trying to see if other people may have been exposed. So a word about prevention, precautions that we can all take in the summer to avoid mosquito-borne illnesses, such as applying mosquito repellent. Now, always look at the label. And wear long sleeve shirts and pants outside, outdoors, sunset and sunrise when mosquitoes are most active, and avoid standing water. And you want to drain standing water to limit mosquito breeding grounds. So what is malaria? Most people, unless you've traveled to an endemic area, you may not ever think about malaria. Now, most of my information comes from the CDC website. Now, malaria is serious. It can be fatal. It's caused by a parasite that infects a certain type of mosquito that feeds on humans. There are 4 kinds of malaria parasites that infect humans. Now, we just have these 3 cases so far in the United States, but that is not the case globally. The World Health Organization estimates that in 2020, there were 241 million clinical cases of malaria, and 620,000 some people died of malaria. Most of them were children in Africa. Now, for most people, symptoms begin 10 days to 4 weeks after you're bitten by that mosquito carrying the parasite. Now, the malaria parasite is carried in the blood, the red blood cells, so it can be transmitted through a blood transfusion, through organ transplant, or through shared needles and syringes that are contaminated with infected blood. Now, did you know that malaria can be transmitted from a mother to her unborn infant before or during delivery? You may also want to know that you don't get it through casual contact, and you don't get it through coughing and sneezing like the flu or the common cold, and it cannot be sexually transmitted. And you don't get it, if you're sitting next to somebody with malaria. So who's at risk for malaria? Anybody can get malaria, folks. And again, you want to get treated. There are prescriptions that are available that depend on your age, whether or not you're pregnant, what are your symptoms, how long you've had it. And again, because severe malaria can cause encephalitis, seizures, mental confusion, kidney failure, liver disease, and death. Now, it's easily diagnosed through a blood test where they look under the microscope for the parasite. And again, if you have a history of travel or you live in one of those 3 counties here in the United States, you should seek immediate medical attention if you're symptomatic. So that is my message today. I think if you want more information, certainly go to the CDC website and you'll get more information than I've covered here. Take care, folks, and be well.